My name is Madhoun. I'm a third-year gastroenterology fellow here at the University of Oklahoma Health Sciences Center. I'm pleased to present my abstract titled The Impact of Video Recording of Colonoscopy on Adenoma Detection Rate. Adenoma detection rate, or ADR, has been established as an important measure of quality for the practice of colonoscopy. Previous reports suggest that it is influenced by several factors, including adequacy of bowel preparation, withdrawal time, and withdrawal techniques. To further understand the impact of factors related to the endoscopist, we examined how video recording of all colonoscopy exam might alter the quality of colonoscopy, or more precisely, whether it improves ADR. We implemented a pre- and post-study design examining screening colonoscopies performed by 6 full-time academic gastroenterologists in our outpatient endoscopy lab. We initially documented a baseline cohort of 200 screening colonoscopies, and then we implemented a policy of recording all colonoscopies. Neither the endoscopist nor the endoscopy nurses were aware of the reason for the study. This study was approved by our institutional review board. The primary outcome of interest for the study was ADR. The secondary outcomes were advanced and hyperplastic polyp detection rate, the impact on withdrawal times, and the size and location of detected polyps. We only included those who came in for screening colonoscopies between the age of 50 and 80 who were asymptomatic and had an adequate bowel preparation. We therefore excluded colonoscopies that were done in patients with personal history of colon cancer, colonic polyps, and patients with a history of colon resection or family history of colon cancer. We collected data regarding demographics, prep quality, and withdrawal time, and polyp characteristics, which included polyp size, number, location, and histology. In order to detect a 10% difference in ADR with a power of 80% and alpha level of 0.05, 200 patients were required in each group. This table showed demographics and characteristics among the two groups. A total of 421 colonoscopies were included. 208 before video recording and 213 after video recording. There were no significant differences in patient age or gender. Mean withdrawal time was 10.9 minutes before video recording and 12.1 minutes after video recording. Again, this difference was not statistically significant. This table showed the primary and some of the secondary outcomes. At least one adenoma was detected 33.7% before video recording and 38.5% after video recording, which represent a numerical increase in ADR, but this was not statistically significant. This was also true for finding at least 2 adenomas, at least 3 adenomas, and for detection of advanced adenoma. On the other hand, hyperplastic polyp detection rate increased from 34.6% before video recording to 44.1% after video recording, which was statistically significant. This figure shows the ADR for each endoscopist. ADR is charted on the vertical axis and endoscopist on the horizontal axis. Yellow indicates before video recording and red indicates after video recording. You can see here that ADR did increase for each endoscopist except for the last one. Among those with low baseline ADR, endoscopist A and B, endoscopist B improved their ADR dramatically, which was statistically significant. This figure shows the mean withdrawal time for each endoscopist, and as you can see, the mean withdrawal time did increase for almost all endoscopists, but it was not statistically significant. This table shows a trend of detecting smaller polyps in the video recording group, and there was a non-significant trend of detecting right-sided adenomas. This study has notable features, including the objective primary outcome, the absence of variability, the detailed histological analysis of the polyps, and the real-world circumstances. Some limitation of this study includes sample size, absence of randomization, lack of standardization, and a high baseline ADR. In conclusion, video recording of colonoscopy may increase the detection of some polyps, right-sided polyps, small adenomas, or hyperplastic polyps. In addition, endoscopists with a low baseline ADR may be most likely to benefit from the implementation of video recording. To further understand the impact on colonoscopy quality, a larger studies may help to define if there is a marginal global benefit on routine video recording. Thank you.